hello there! Hi, and hello to all the nurse champs out there. I'm Nurse Niezl, and welcome back to my channel. To those of you who are new here, thank you and welcome to the team. And to those who are going to take their exam anytime soon, I wish you all the luck. Like I always said, another day to learn about OSCE and another day closer to becoming a UK registered nurse. If you are about to take your OSCE anytime soon, then this video is for you. So before we go through this, I'd like to give this video a like and subscribe to my channel and become part of the team. Also, if you wanted to get notified every time I post new videos regarding OSCE, please hit the notification bell, somewhere over there. I would really appreciate it and I'd be more enthusiastic to post more videos. Today we're going to discuss Oral Care Plan Station. That being said, let's begin. Last November 2022, the NMC added new skill stations. One of them is the Oral Care Plan Station. This Oral Care Plan Station have 4 scenarios in which there are intervention is specific in that scenario, okay? So what are these scenarios again? We have got here the critical care scenario, the learning and physical disability, also the cancer treatment, and last we've got the end of life scenario, okay? So, and yes, as you've seen in the thumbnail, we are going to discuss Oral Care Plan, the end of life. I also got videos regarding all the other scenarios. If you could just head back to my channel and click the Nurse Niezl playlist, every OSCE video is there, okay? Make sure you subscribe and join our family, and don't forget to hit the notification bell if you want to get notified just in case I post new videos, okay? I just wanted you to know that we have got a marking criteria that we need to follow. Okay, these marking criteria are very important because the marking criteria is basically the answer to making this oral care plan. So I need you to understand all of them, okay? I know I said the marking criteria is the answer. I'm not saying that you need to just copy, memorize it, and paste it on or write it on your exam paper. No, you have to understand what oral care plan is about, okay? Because once you have your PIN and you practice as a nurse in the hospital, care home, and the community setting, you will have this additional skill, which is you know how to do an oral care plan for the patient, just in case you are exposed to a cancer patient, an end of life, with this this video is about. Also with a patient with learning and physical disability, and for the critical care patient, this is what you're going to do. This is the plan that you're going to do just in case you encounter this kind of scenarios, okay? Again, you have to know this by heart. But obviously, look at this marking criteria right here. Too many, isn't it? So what we're gonna do in this video, we're gonna break this down into smaller keywords for us to be able to remember this once we go to the exam. Because even though we know this by heart, we still have to have that word that would represent our answers, okay? So we're gonna have this, do this as our keywords, okay? And obviously we're gonna have a sample scenario at the end, okay? You're gonna be receiving a scenario like this, and at the back is like this, in which the first page is the scenario, the back part is where you write your care plan. So how are you gonna write? What are those things that you are gonna write? This is the important part, the marking criteria, which is the Bible for all the OSCE station. Now, okay, we all know that end of life care is the care that we give, is the care or the support that we give to those patients who are in the last hours, days, weeks, or months, or even year of their lives, okay? These are the care that we give to them, okay? So please, if ever you have this patient, make sure to give them the best possible care. So now, let's dig into it. First criteria is twice daily teeth and denture cleaning with soft toothbrush if able to tolerate. So what's the keyword that we can put here? Yes, very simple, toothbrush. When you see the word toothbrush, you can remember, okay, I need to brush the patient's teeth or dentures twice daily using a soft toothbrush, okay? See, that's how easy it is. Next one, twice daily chlorhexidine mouthwash if again the patient is able to tolerate. So what's our keyword? Chlorhexidine mouthwash. That's correct. The third one is Regular oral cleansing and hydration. So how are we going to hydrate the patient's mouth, or cleanse or hydrate the patient's mouth? Like I always said, ice chips or sips of water if the patient is able to tolerate it. Okay, we can also use a spray or a dropper. Yeah, and we can do this throughout the day. Okay, remove the dentures overnight and soak it. Soak them in a cleaning solution. Again, remove the dentures overnight and soak them in a cleaning solution. Okay, you have to do that as well. Next criteria is to keep the lips clean and also moist by using again a moisturizer or a lip balm. Okay, but make sure to not use a Vaseline or a petroleum jelly, especially if the patient is on oxygen. Most of the patient on end of life is having their oxygen on. Again, no petroleum jelly or Vaseline, especially if the patient is on oxygen. That's high risk, isn't it? Yeah, that's it. The next criteria then identifies the need for 8-hourly reassessment. So again, reassessment, just like the previous scenario, this is the last two. Okay, the 8-hourly reassessment, and obviously any other aspect that we could add. Okay, if the candidate can identify an aspect of care that is relevant to the scenario, you can add that one. Okay, these last two are always there in all of the 4 scenarios. Okay, all right, so at least we've memorized 2. It's already there. Only thing that we need to remember is another 4, because we need what? Yes, 6 relevant aspects of care. Okay, and that is the marking criteria. Obviously, you have to make your writing legible, because this is a writing station. Make your handwriting legible and make sure that the strike through errors retain legibility. Straight strike through and then sign it. That's all you got to do. Okay, that's all you got to do for the errors. Okay, so there you have it, guys. We've discussed all the marking criteria. We've come now to the favorite segment of this video, the sample scenario and of course the answers. Okay, so I made this sample scenario right here. Let's read it first. Again, let me just remind you, this is not the scenario in the exam. I just made this one up. Okay, let's read it. You are a nurse looking after Rachel COHEN. She was admitted in your ward due to stage 4 lung cancer. And now patient is now put to an end-of-life care. She is still talking, she's still alert, but she is sometimes tired, drowsy, and sleepy. She's got dentures, and she can still manage to eat small amounts of food, obviously with assistance. I need you to make a care plan on how to provide adequate oral care to the patient based on the scenario that I have mentioned. Okay, this is a time that you're gonna pause this video and time yourself for 8 minutes and then head back here once you're finished writing. Okay, again, this is a silent station. You have to practice by timing yourself at the same time. Okay, here's a scenario, and pause this video right over here. Click this button. Oh, hello there! That was quick. You have done your answer? Okay, have you done it for 8 minutes? Good. Now, here is my answer for this scenario. Again, let me remind you, this is just my answer. I'm not saying that this is correct, okay? This is just my answer, just in case I take the exam. Okay? Yeah, okay, here we go. Enjoy! I will do an oral care to the patient by cleaning teeth and dentures with soft toothbrush twice daily, if the patient is able to tolerate the procedure. If patient is able to tolerate, I will give the patient chlorhexidine mouthwash. I will regularly perform oral cleansing, hydration by giving Rachel ice chips or encourage her to take sips of water. If unable, then I will use dropper or spray to make sure that the patient remains hydrated throughout the day. At night, I will remove patient's dentures and soak them in cleansing solution overnight. I will keep the patient's lips clean and moist using moisturizer or lip balm, ensuring not to use petroleum jelly or Vaseline if the patient is receiving oxygen. I will reassess and monitor patients every 8 hourly. And just like that, so we are done with our oral care plan for the end of life scenario. Okay? I hope you learned something today, and good luck on your upcoming OSCE exam. Also, if you want more OSCE videos, head to my channel, click the Nurse Niezl playlist, in which these are all OSCE videos that can help you pass your OSCE exam. Make sure to leave this video a like and subscribe to my channel. Also, make sure to hit the notification bell if you want to get notified just in case I post more OSCE videos. This has been Nurse Niezl, and I'll see you on the next one. Bye!